Hey everyone, welcome to Voice of Echo. For those of you watching my video for the first time, this channel is designed to inform and spread awareness about different social issues. If you go ahead and watch my introduction video, I did go over it in detail, so feel free to watch that before we get started. In today's video, I'll be debunking some of the myths about COVID-19 vaccines and delivering to you the facts. So here we have the 6 most common myths, and I'll be touching on each one of them in this video. Alright, so first we have, if I already had COVID-19, I don't need the vaccine. This is clearly not true because the antibodies from a vaccine are much more robust and more predictable than natural antibodies post-infection. Because reinfection with COVID-19 is possible, we will still benefit from getting vaccinated. Several subjects who were previously infected were tested in the Pfizer trial and got vaccinated without any ill effects. So even if you already had COVID before, it's recommended to get the vaccine. For the second myth, we have researchers rush the development of the vaccine, so it cannot be trusted. While using mRNA technology for COVID vaccines is new, the mRNA technology itself has been used for many decades. The reason why scientists were able to develop fast is because they had the RNA sequence of the virus released in January of 2020. Nothing about the clinical trials for the vaccines was rushed, nor were any shortcuts taken, hence, the overall process was relatively smooth and fast. The third myth is that the vaccine can affect one's fertility. So far, there has been no link between the COVID-19 vaccines and a negative impact on female fertility. Because the mRNA degrades so rapidly, it is highly unlikely that the vaccine could cause issues with fertility. During the Pfizer vaccine tests, 23 women volunteers in the study became pregnant. Thus, there is currently no evidence that COVID-19 vaccines causes any problems with pregnancy, including the development of the placenta. For the fourth myth, we have, if I got the vaccine, I don't need to wear masks or social distance. On April 27, 2021, the US CDC announced that fully vaccinated people will not need to wear a mask in small outdoor settings, except in crowded settings and venues. For the purposes of this guidance, people are considered fully vaccinated 2 weeks after they receive the second dose for the Pfizer or Moderna vaccines, or 2 weeks after their single dose for the Johnson & Johnson vaccine. While this does loosen the limitations of certain activities, the CDC stated that the fully vaccinated should continue to take precautions indoors by wearing a well-fitted mask, especially when visiting unvaccinated people and large-sized gatherings. Officials caution that crowded outdoor settings pose risks, and they urge everyone, both the vaccinated and the unvaccinated, to wear masks when attending activities like sporting events, live performances, and parades. It is crucial that people do not ignore these precautions and adhere to these instructions. The fifth myth is that one can get COVID-19 from the vaccine. This is completely false because the vaccine is non-infectious, unlike some of the previous live attenuated virus vaccines. The vaccines instruct your cells to reproduce a protein, but do not contain the virus itself. Our last myth is that the vaccine will change one's DNA. As previously mentioned, the vaccines available in the US involve delivering instructions to our cells to start building protection against the virus. However, the material never enters the nucleus of the cell, which is where our DNA is kept. This means the genetic material in the vaccines cannot affect or interact with our DNA in any kind of way. All COVID-19 vaccines work with the body's natural defenses to safely develop immunity to disease. I've included the sources in the description box below, so if you would like to read more in detail, it's there for you. Alright, so that is it for today's video. I hope you guys found my video helpful and informational. Thank you for watching and stay safe, everyone.